Good morning, everyone, and welcome to Eggs and Issues. And this edition, we are going to talk healthcare. Joe Millage filling in for Ken Alsop, who's on the road today following William Penn, the Statesman, in tournament action for basketball. Coach Henry has his crew, and I believe it's Park City, Kansas today, as they're in the second round of the tournament. Continue to follow Oski News for the latest on the Statesman, and we wish them good luck. We want to welcome our viewers on MCG Channel 7 and Oski News Live, as well as the Mahaska Chamber Facebook page as well. Keep in mind, you are welcome to submit questions. Our focus and our topic this week will be on healthcare, and we want to thank our panel for being here today. We also want to thank the Mahaska Chamber and Development Group for putting these together and hosting these, as well as Oski News and the use of their studios, along with KIIC Studios. To Andy McGuire. Andy will be moderating and monitoring the chats and any of your questions that might come in over social media, and for Midwest One Bank for preparing and for helping us with the coffee this morning, the ever-needed coffee on a Saturday morning. So again, we welcome you, and we also welcome our panel this morning. Dr. Tim Breon is here with us, Patty Malloy, as well as Jamie Robinson. So without further ado, I'm going to go off screen here, and we want to thank Dylan for helping us behind the scenes, behind the camera as well, and we will get started. So your questions are welcome. And good morning, you guys. Thanks for coming in this morning. We appreciate you being here. And, you know, the interesting thing about today's date is that we're 1 year later. And I know we've all had those thoughts, and we've been thinking about, man, it feels like we've all aged maybe 3 or 4 years this last year. But, man, where we've come in a year is just incredible to think about. There's been some conversation in the news of late about the vaccine rollout, and even just in the last 24 hours that Iowa has vaccinated 1 million people in the state, which that number seems to have popped up quite rapidly here lately. But let's find out what that means and what's happening in Mahaska County. So let's find out where we're at with vaccines right now. So my question really to start out is supply. How many vaccines are out there? Are we are lacking vaccines? People that are in the restricted categories, are they able to get vaccines? Let's kind of start with that. And Patty, we'll kind of start with you this morning, Public Health Coordinator.
Okay, thank you. So vaccines in Mahaska County, Public Health is being allocated 400 doses each week, and that started, we started the 1A back in December, and so that was the healthcare workers and long-term healthcare facilities, and we went through that. And then February 1st, we started with our Phase 1B, which was the 65 and older, and kind of those tier work groups, which was teachers, law enforcement, those groups. Went on into manufacturing, and we're working with those, and then some of the other tiers. So Public Health is focusing on the tiers, and then the allocations that we gave, we shared with the pharmacies and kind of split it 50-50 that they could do the 65 and older. Our first 2 weeks, the pharmacies weren't receiving separate allocations, and kind of that second week of February, Hy-Vee started getting allocations from the federal pharmacy program. So that meant that Public Health got their 400 doses, as well as Hy-Vee got some more doses. So that was, roughly probably 100 or more a week through Hy-Vee. So we've been seeing allocations increase. It just doesn't always show up because our allocation has been the same. And last week we found out that Walmart is going to start receiving sometime this month a separate allocation. So we have a meeting every Friday with the Iowa Department of Public Health. Our allocation through Public Health will stay the same. However, the allocations with the pharmacies will start with Walmart. So, I think we've done pretty well for our county. Doses received is around 5,000 as of yesterday. There's been 5,147 doses administered to Mahaska County residents. So again, those are including the second doses, and a few of those were the Johnson & Johnson if they got them outside the county. We know our manufacturing facilities in some counties receive that because it's one dose and done. So if they go to a manufacturer, it's just easier if they're doing 1,000 doses to do that group that way. So yeah, I think we've done well. We did open up Monday to the people under 65 with underlying health conditions. So if you're needing a vaccine in Mahaska County, getting signed up through our call center that Jamie's going to talk about a little bit is one way, but now with the pharmacies getting it and they have automated scheduling, there's other options as well.
Yeah, very good. And the Johnson and Johnson is the single shot, is Pfizer too? No, Pfizer and Moderna are both double shots. Has there been any issue with that second shot in terms of the availability of the second shot?
Yeah, so those are sent to us in separate allocations, the prime dose or first dose, and then you get your boost dose shipment. So we've kept those separate and been able to have those available when people are needing those. And then I've seen some information about people not getting that second dose. We've had a good turnout. So we started boost dosing the first week of March, and this week, with a lot more people. And we schedule people with their first dose 28 days. Sometimes we have people have to reschedule for various reasons, but for the most part, we've seen, I would say a 90-95% show rate for that second dose.
Very good, and we'll just turn quickly to Dr. Breon and maybe the rest of the panel, just in terms of the any side effects. There have been a few news reports of side effects. Are we seeing anything from the shot itself? And there's still some questions out there. Should I get the vaccine? Should I get the shot? Hearing about the very rare cases maybe of side effects that might play into people's decision there. What do we know, or what are we hearing about any side effects to what's happening out there?
Yeah, great question. I think we do see side effects, but they're kind of expected. So I think anytime your immune system gets kicked in gear, those side effects are expected. That's your immune system doing its thing. So yeah, there are many people that get both shots and have no side effects at all. And there are many people that get it and they have a sore arm, and there are people that get it and they may have a fever, and there are people that get it and they may have some body aches. But those are just expected things that your immune system does when it's reacting and it's doing what it's supposed to do. So I think the fact that there are side effects, initially people were concerned that the vaccine was unsafe, and so we had lots of questions about that early on. Haven't had so many of those questions recently. I think people are looking around and realizing that lots of people have been vaccinated. People seem to be doing fine with it, and we certainly see the numbers going down. And so for a variety of reasons, and so I think we're seeing fewer questions about just the overall concern of getting the vaccination, so we don't have to talk about that as much anymore. And then I think, once again, just understanding that side effects of any vaccination program and the side effects of a viral illness are certainly things that we kind of expect, and our immune system kicking into gear and doing its thing sometimes is going to make us feel worse. I think maybe more side effect likelihood with the second shot, but that's just anecdotal. And once again, we've had people that haven't had any symptoms. I haven't had any symptoms whatsoever, and so that's great. But yeah.
An interesting take. So to actually say, well, yeah, that's you probably will have some side effects, and that's normal. And yeah, I remember Tim, Dr. Breon, going out to the hospital. I think it was the week before Christmas when you were vaccinated, and it's interesting to hear no adverse side effects from your shot, and so that's great. And Jamie, I think you said also you didn't seem to have any side effects. You just recently took
a little sore arm, but otherwise I was fine. Yeah.
I'll have you grab the microphone, Jamie Robinson with Mahaska EMA. And Jamie, Patty referenced the call center. This is another big step, because I think there's been some questions about, well, how do I get the vaccine? Where do I go? Am I eligible? If I'm not eligible, can I pre-register? So talk us through that and a little bit about this call center, and we'll flash the number up on the screen as well.
Great. All right, Joe. So yeah, the call center is set up right here at the mall. Thanks to Musco for giving us the space, and MCG for setting up all the phone lines and getting everything in place for us. This was truly a collaborative effort between public health, the hospital, EMA, and of course private with Musco, MCG being involved as well. But the call center is open Monday through Friday, 9 to 5. We realized when we put out the initial post on Facebook or on our website, hey, go to this link, fill it out, that we do have an older population that may not twit or tweet, I guess is the word, not twit.
Either
Tweet.
one works
Yeah,
fine.
I also say
We know what
pound
you
instead
mean.
of hashtag, because back in my day. But yeah, so they're not out on Facebook or looking at all the different things out there. So we wanted to give them a way that they could get registered, and that was by setting up these phone lines as well. So we have volunteers made up of the Mahaska County CERT team, as well as volunteers from the hospital coming out Monday through Friday, 9 to 5, to answer those calls. I can tell you they are answering several calls, and we're also seeing people still complete the form online as well. Pre-registering basically gets you in line, and we are setting up appointments as well. So this has kind of turned into quite the process up here at the mall. We went from just pre-registering everybody to now we're actually filling appointment spots. We're working with the other pharmacies in town as well as the clinics that are giving shots to make sure that all their slots are filled. Because as we know, once we crack the seal on one of those vaccines, we need to use it all, and we're doing that.
Well, we've put the number up on the screen here for folks, but don't call now because nobody will answer your call. But Monday
Right.
through Friday, 9 to 5, 676-3599, and that is going on. That is working, and you guys are doing a great job there. And again, thanks to MCG for their assistance there. We do have some questions starting to come in on social media, and we'll get to those in just a second. I remember, Dr. Breon, when I was out and watching some of those first vaccines get administered, there was still some conversation at the hospital around the sheds outside, and the thought was, hey, let's leave those sheds there so that if we can administer vaccines kind of in a drive-through methodology, we'll have that already there and ready to go. Is that still the plan at the hospital, or what do we know about how vaccines will be administered maybe to a more broad public?
Yeah, I think probably what limited our need to do that was just the fact that we didn't have availability for the vaccines to give mass vaccinations. And so the way that the vaccines have been rolled out, it's allowed us the time to set appointments and schedule vaccinations. And so for that reason, we really haven't done a mass vaccination plan. We have left the sheds and we left a lot of things in place because we're not so sure what's going to happen with the coronavirus either in the next few months. And so we just want to stand prepared and not be caught off guard. But we think the vaccination process has been working good. And I would like to thank certainly Public Health, Mahaska Health, and also the emergency management team. Once again, it's just another example of how everybody comes together for a very unique circumstance. This pandemic has posed many challenges. And every time there's been a challenge, we've kind of risen to the challenge. And so I want to thank Patty and Jamie and their respective people because they've done an excellent job in putting something together that is just not routine. You know, it's quite out of character for us to do the things that we've done in the last year, and the vaccination process has been no exception. So I want to thank them for all the things that they've done.
Outstanding. And here's a question from social media. Brent says, my employer is offering the Johnson & Johnson vaccine. In your opinion, should I wait until I can get a more effective vaccine? I think the Johnson & Johnson was maybe a little bit lower on the efficacy rate, if I've got that word right. So Brent's asking, well, maybe I should wait and get one that's a little better. Patty, go ahead and pick up the mic, and we'll see what you say about that.
Yes, so through, just a perspective of public health, as we say, get the vaccine when you can. I think when they say the efficacy for the Johnson & Johnson is a little bit lower, things that we've looked at is, for one thing, it hasn't been researched as long as the Moderna and the Pfizer. So I think Moderna and Pfizer started back in July doing their studies, and the Johnson & Johnson was maybe more in the fall, like September. So it seems like the more information and data they collect, that they are going to be, pretty compatible. So if you can get a vaccine, we have people kind of doing the opposite. I just want one shot, so I'm going to wait for the Johnson & Johnson. We don't know in Mahaska County when that's going to happen. We know that Iowa received about 36,000 doses the first week of March. The second week, they didn't get any. And now this third week, we're projected to get about 3,600. So, the more that's produced, maybe we'll get it, maybe we won't. But again, some of the larger metropolitan areas may see that quicker than we do just because it's one dose and done, and they're doing a lot more people. So, from our perspective is just get the vaccine. So.
Very good. Here's another question coming in on social media. As vaccines become more available, what are the changes we can look forward to in public spaces while still following the best public health practices? So, in other words, when can we get rid of the masks? Maybe that's one of it, and maybe part of that is, we're going to start seeing events and gatherings and get-togethers and things like that, where as the numbers continue to fall, the vaccines continue to go up. Is that going to change how our schedules, our events, our gatherings, things like that? So I don't know, Jamie, if that's you or Patty, one of the two.
Definitely Patty.
Yeah, so I think the CDC is going to be putting new guidelines out here pretty soon. I know one of the things they've said is if, you're with a group of people, like the three of us up here, we have all been vaccinated. We've had our second doses. It's been 2 weeks. We wouldn't necessarily, if we were, it was just us, have to mask. We want to be cautious, because not everybody's had the chance to get vaccinated. We want to have higher vaccination rates, and then I do think that we'll see some of the restrictions being lifted a little bit. So yeah, that's a great question. Once the vaccine is available to more people, that those restrictions can be beneficial. But we want to be cautious too, because not everybody's choosing to get vaccinated. Those people are going to have to continue to be cautious, just because we know the longer a virus spreads, the more it can mutate, like we see with the flu virus. It's a shot boost every year. We're still learning a lot about this, so I just always say there's more to come.
Very good. Here's another question coming in. It says the president mentioned that he expected life to kind of get back to normal by July 4th. And this is somewhat related, so maybe you'd answer it the same way. Do you feel like that would be the case here in Mahaska County, July 4th?
Yeah, I think that's a good deadline. As we get more vaccine and more people vaccinated, that's going to definitely change how we can do things.
All right. I would just like, because this is the 1 year anniversary, I would like to just kind of take the mic around and ask just your overall, as you look back, your thoughts on the year, what we've learned, maybe some of the great things that have come out of what we've had to endure as a people. So I don't know who would like to go first, but before we move on to maybe another topic or two, if no more questions come in, we'll move on to some other healthcare topics. Just give us a little bit of your thoughts and feelings. We got this 1 year anniversary kind of behind us, and here's where we're at. And what are your thoughts, Jamie?
I think the big thing for me is, the information changes so often, it's hard to really know what we've learned. We've learned that it changes extremely fast. And I know that's the thing we always hear, at least at this level, is, they said this 2 months ago, but now they're saying this, or they said that, and like Patty just said here a little bit ago with the vaccine, this information is changing all the time. So we try to take that information in and evaluate and make our decisions based off that. I think the big takeaway for me has been the collaboration between all the entities that are playing roles throughout this entire pandemic. You talk about those sheds, and when we brought those in, you had leading edge builders drop everything they were doing to come out and put a roof on that. Or you got Mahaska Drug, which we all know Jean at Mahaska Drug always goes above and beyond, but once again, just shows her commitment to this community. Walmart, your Hy-Vee, everybody's just come together to try to do what's best for our community. And I know there's lots of frustrations of when we can do this or not wear these. And I can tell you, sitting up here with the mask on, I hate it. I hate wearing a mask all the time. But it's something that we have to do, and we're going to get through this, and we're going to be stronger for it. And hopefully someday when we're talking about the anniversary of it, it's way in the past, and we learn something from this, and we build on it. And that would be the big thing for me going forward, is we need to take this in and lessons learned and work through processes. And this isn't the first pandemic that's affected the United States, and it probably won't be the last, but we need to be better prepared for it.
I think a mask wearing, a mask burning ceremony in the downtown park would be fun. Patty, you're next.
Yeah, and I'll echo what Jamie said. We have built a lot of partnerships, I think, this past year that, we maybe had, but not at the level we have now. And we just have some great teams. Everybody that Jamie said, we've just, people in the community have been, great. Working at the vaccine clinics, it's better than I think the beginning. I look back to March. March 8th was our 1 year anniversary, and we were busy planning. We did a lot of planning. We didn't have a lot of cases, and then as the year went on, we had a lot of cases, and that really spiked in the fall, and so we were busy with that. And now we're into the vaccine, so it just really hasn't seemed like it's slowed down in the last year, but I think in the last couple months it's been more hopeful. So just looking for an end and some relief is nice. So and our condolences to all the families that have lost loved ones. We know this has been tough. It's been a tough year for a lot of people. With other things, there's other things than COVID going on, but just I think the relationships built, we're a stronger community for that.
Dr. Breon.
We're talking about coronavirus again, is that right?
Yes.
Yeah, I almost forgot about that. No, I think, what a year. I would echo all the things that have already been said. I also think, we kind of break it down into a period of time when we were just gathering as much information early on that we could. I remember trying to encourage our teams early on because of just the unknown. And then as we started to move through the unknown more to the known, it became more of an educational process of educating others about it. And then beyond that, it became a time where nobody really wanted to know any more about it. And it was an opportunity for us as a healthcare team just to start trying to take care of people, to listen to people, to not be so bound on an opinion or any facts as much as it was just time to listen to people. Everybody suffered some loss during this year, whether it was the loss of a loved one or whether it was just the loss of a job or a loss of finances or a loss of opportunities or there was loss in some regard for everybody. Everybody felt some pain as a result of this COVID, whether you believed in it or not. And so I think anytime there's pain and it's collectively felt, there's always greater opportunity to meet that need. And as a facility, I've seen our group of healthcare people, staff, providers, administration, allied professionals, other people in the community that we work with and have been working with and have developed relationships with. It's been really interesting to see how everybody has come together with the common goal of trying to just help people. And I think right now we have a more cohesive team as a result of that we've ever had. And so the blessing of all that is anytime there's a challenge, I think a good team comes together, and this community has all come together. And I think we have a better team, and we're ready and better prepared to just meet the healthcare needs of our community right now than we've ever been in the recent past. And so that's been one good side effect. And I think it's made me better. I think Jamie and Patty would also agree. I think we're just better for it. And so, I thank God for the fact that when he gives us opportunities, he also gives us the ability to meet those needs with his help, and I think we can all be better for that.
All right, couple other questions coming in here before we turn to some more generic healthcare questions. So last summer, it was recommended that groups working on events or activities like a summer camp or a concert or other outdoor activity contact public health. Should those groups still be in contact with public health, either for permission or guidance?
Always open for guidance. Always.
Yeah, I guess if you have specific questions towards that, we'll look towards the, the recommendations of Iowa Department of Public Health, which we follow CDC, and then, there's guidance from the governor's office as well as to, what you can and can't do. So, but definitely there's recommendations for doing it safely and, how to do it. So.
Nancy asks, will the federal distribution of vaccines to retail pharmacies like Mahaska Drug and Hy-Vee be announced on the public health Emea websites alongside the county's allocation of vaccines? If not, where can people find that information?
Great question. Yeah, I don't know always. I mean, I have close contact with the pharmacies. I know currently Mahaska Drug is receiving 100 doses a week from public health. Our allocation is 400. So Walmart was receiving 100 up until this past week. So currently, this next week, it'll be 300 of the 400 doses received through public health. 100 will be at Mahaska Drug and 300 at Mahaska Health. Hy-Vee, I don't always know. I mean, I've heard 130, 200 one week. I don't think they always know. And Walmart doesn't, until they get it, they don't always know. So that's kind of a hard number. I'm not sure, but great question. I can look into that and put something on Facebook if I find out.
Very good. And one more time, we're going to throw that phone number up to the call center that Mahaska Emergency Management is operating. Again, 676-3599. Get questions answered, help find appointments, pre-register, but don't call now because they're only open Monday through Friday from 9 to 5. Oh, I was going to move on to just some what else is going on in the business, but one more question here. Dr. Breon, would you like to see anything specifically happen in the community to address the collective pain you describe? Do you see a need for us to come together to heal and grieve?
The answer is yes. I think, is there a community-wide event or a community-wide resource that's available for that? And I think none that I'm aware of, and could we do something? I'm sure we could. I think there are collective groups that are already doing that. I think it's an excellent opportunity for businesses that are aware of that to make sure that they look at their available resources to help their employees process some of the stuff that they've been through this last year. I'm sure that people are seeing some of the side effects of this among their employees with HR and with issues that have shown up. I think certainly churches have seen this as an opportunity, hopefully, to address that and to tackle that, and should be well equipped to do that. I think just the fact that we have to recognize sometimes what the real issue is now, and I think it is just that. It's not so much you may have a different opinion from somebody else, or you may have suffered more than somebody else. I think the fact of the matter is that everybody has some negative effect from the past year, and I think anytime that happens, you have to grieve, you have to process that. And I think understanding that is true. Any relationships you may be in where they're challenged, that may be a component. So recognizing that and addressing that, forgiving for that, having grace for others, all those things that are just a good idea in general should probably be an active thought process that you would keep in mind anytime you're dealing with people. So yes, that's a great question.
Okay, we're going to just keep going with the questions coming in online. So Connie asked, may people schedule their vaccine appointment through Walmart, or is that just through public health for vaccination appointments?
So up until last week, the call center was doing the scheduling for Walmart. Now that they're getting a separate allocation, their corporate is going to now, I believe it'll be online scheduling. Same with Hy-Vee. Theirs is an automated online that they have to go through. So those are those two options for public health and Mahaska Drug. It'll be through the call center, but the call center can help facilitate, knowing where's, vaccine is available. So, and one thing that, we've talked about too is that when you, if you're not eligible right now, go ahead and sign up, because just like last week, Thursday, we found out that they were adding the under 65 with underlying health conditions. We already had that developed into the pre-registration that if you weren't 65 but you had an underlying health condition, and same with when it moves on to the general public, If you haven't marked that you're 65 or have an underlying health condition, still sign up, because that will get you a spot in the pre-registration and a call from the call center. So those are all things, and it helps us to also prepare to know how many people. And we do have plans. You mentioned the drive-through buildings. We have plans for a mass vaccination clinic when we find out we're going to get an allocation. And again, we don't always know, and sometimes it's pretty quick that we know. So we're planning for that mass vaccination clinic. Emergency Management and Public Health have done a walkthrough through the Gateway Church. They've been gracious to give us that venue. We've had people volunteer to give vaccines, to help volunteer. So, that's in the works. So we're just waiting for, a good amount of vaccine to make a good mass vaccination clinic. So when it opens up to the general public, I think that's probably when it'll happen. So.
Very good. I think we'll flip the script just a little bit. Before we do that, I want to promote a couple of future Eggs and Issues coming up in 2 weeks. It's going to be our state government officials, our local representatives will be here in 2 weeks. And then in April, this will be interesting. Marionette Miller Meeks is scheduled for April 17th, Eggs and Issues. Whether she will still be our Iowa District 2 representative or not, we'll find out if you're following the news on that. But those are a couple, and again, thanks to Mahaska Chamber and Development for supporting and sponsoring these community outreach and communication opportunities. So let's flip the script just a little bit, because while COVID was going on, the regular business of the hospital was also happening, and I just wanted to find out from Dr. Breon what else is going on at Mahaska Health, and bring us up to speed on maybe new staff or changes at the hospital.
Yeah, that's a great question. Thanks, Joe. I think to answer the question simply, there's a lot of stuff going on. So this year we have several new providers that will be joining us after July. So several primary care physicians with that will be delivering babies are going to be joining us. We have several nurse practitioners to join us. We have another general surgeon that's coming on board. We have a lot of other staff that are coming on board, allied health professionals. We're actually building out a whole new area of the old hospital right beside the current primary care clinic. So we'll have a separate new pod for a lot of our new healthcare providers. And so that reconstruction process will end up with a beautiful new clinic space. And so that will open up by the middle of May, by the end of May, hopefully. We'll be ready for that when the new providers come. We are just in the third week of launching our new electronic medical record. And so we now are part of Epic Community Connect, and Epic is one of the best electronic medical records that are available for hospitals. And so that medical record system has been installed. We've been working on that for well over a year. We've had a lot of support from the community in that, a lot of patience with our patients, because as you start a new electronic medical record, it's quite a challenge. But I've heard nothing but good things from the staff and people at the hospital that are using that already. It's something that we've been training on for 6 months, and it's been something that's taken a lot of time and invested lots of time by all the people at the hospital that are using that. And so that's just a great new addition, because it's going to allow the medical record to be available to everybody online. It'll also allow us to see charts not only in our facility, but other facilities that share the same system. And so for the first time, really, we're able to share charts in a HIPAA-compliant way, a privacy-compliant way. And so sharing of information among hospitals that have that same system, which are increasing every day, is going to be excellent. And just the ability that it allows us to do point-of-care documentation, the ability that it gives us to follow patients in the future and to make sure screening studies are done and to make sure that people don't fall through the cracks. Also, point-of-care billing. It's just going to speed up and make our whole process a lot more efficient. So we're really excited. Third weekend to that right now, just finished this weekend. We just have other construction processes going on in the hospital. It's just kind of been a busy time, and so really excited for all the things that are coming place. Many of these things we've been planning for the last 3-4 years, and so for all these things to come to fruition, by the end of this time next year, we'll have new providers in place, new care areas in the hospital available, and we're currently planning out 5 and 10 years as well. So really an exciting time at Mahaska Health.
Yeah, it's kind of amazing to think about a lot of the attention on COVID, and yet the business of the hospital still continues. So I know there's Mr. Durande has been busy and keeping the staff all encouraged and together and motivated, so thank you very much for that update. Let's flip the script here just again a little bit. I've got a question coming in. If there are any updates to the Emea funding that you can talk about, so I guess that might be for Jamie. And then I'm not sure what the question relates to as you frown at me over there, Jamie. But I'll dovetail that with, normally in March we have severe weather awareness, so not necessarily healthcare, but as long as we've got you here, we can talk a little bit about Severe Weather Awareness Week, which is coming up. But I'm not sure the context on that question.
Is in reference to funding, Joe?
Yes.
So the only funding I'm aware of is the new $1.9 trillion package that the president just signed into law, which citizens would be getting, if you're eligible, would automatically get that money deposited if you have that set up with the IRS. Otherwise, it'll be a check. Most people should know that process just because some have already received funding in the past. So this should follow those same guidelines.
I'm not sure if it was related to emergency management in any way.
Well, as far as our funding from the federal, the president also released that they were doing 100%. So typically when we have a disaster, we get so much funding from FEMA, 75%. We get 10% from the state, and then 15% of that we have to do a local match. President Biden has changed that for this declaration because it's such a widespread, and FEMA is covering 100% of our reimbursement or our submittals. So I know for us, we're right around $140,000, $150,000 that we've submitted. We have gotten a large portion of that already, on top of some CARES funding. We also got EMPGS, so it's a supplemental emergency management performance grant that was sent out. We did apply for that, and we were awarded about $20,000 that we put into our emergency operations center, putting up some new IT equipment. And it sounds like there'll be another supplemental grant coming out as well that we'll definitely be applying for. So, yeah, we're always trying to get everything reimbursed. We've worked with our partners very closely throughout this pandemic, and when we need something, we go out and get it. My commission has been very supportive of that, making sure that we have the tools needed, and we were able to respond. To your other question, yes, March is Severe Weather Awareness Month. March 22nd through the 26th is the week. We'll put some posts on our Facebook page. We'll also participate in the statewide tornado drill, which is March 24th. That's a Wednesday. It will coincide with the weather alert, weather radio system. So if you hear the sirens on a Wednesday, starting at around 11 a.m., I would also encourage businesses, schools, if they're in session, starting at 11 o'clock, run through your drills. Students, or if you're at a business, have them go to your tornado shelters. Follow along with the drill. We're going to start off with a watch, and then we'll issue the warning, and we'll actually sound the sirens, and just like it was the real deal. That's weather permitting, of course. If we have severe weather that day, we will not practice a drill in the middle of that. The way it's looking, it could be snowing that day, so we're not sure. But yes. Also, daylight savings times coming up tonight.
Yeah, Dr. Breon, when he came in, wanted to make sure I remembered to turn my clock back an hour, but I realized he wanted me late for church tomorrow.
Yes,
he wanted me to be late for church tomorrow.
Forward. While you're changing your clock, let's check the batteries and those smoke alarms, carbon monoxide detectors, weather radios. If you have an outdated smoke alarm, more than 10 years, carbon monoxide detector more than 10 years, let's look at replacing those. Unfortunately, we just had a fire yesterday, and one of the nice things after the fire, and it may not sound nice to everybody else, but I could hear the alarms going off. To me, that's a good thing. I mean, you want to be able to hear those alarms at 2 o'clock in the morning. So make sure your batteries are fresh, make sure your detectors are fresh, carbon monoxide is important, smoke, and then, of course, the good old weather radio, or you can sign up for Mahaska alerts at mahaskaready.com, which sends notifications right to your phone.
Very good. Very good. Well, we'll just kind of be open forum here. Anything else anybody would like to add that maybe we didn't cover, or the question that was not asked? Did we get it all? Did we get it all in? You guys?
I think so. I mean, I think we covered it very well.
Are
I would like to say, though, I mean, Dr. Breon had mentioned Mr. Durande, and Kevin has been instrumental throughout this process, working with all the different entities, and he as well has made sure that individuals have the resources that they need. So we tried to limit the amount of people here today, and I think he would have really provided some good info, but hats off to Mr. Durande for all that he's been doing out there.
You're here. All right. And I don't know, anybody having a special birthday that we want to just give a shout out?
I think there's a guy named my dad. My dad turns 91 years old today.
Wow.
So
Congratulations.
happy birthday to Irvin, Breon, and Hedrick. And the last thing, I think just even thanking Oski News and Ken Alsop, you know, I think he's been, and yourself as well, Joe, I think really helpful in allowing us to disseminate really good information. And so sometimes a lot of information gets out there. It's not always the best information, but I appreciate Oski News and Joe helping us get information out when we needed to in a variety of, using a variety of media. So thanks for that as well.
Yeah, it's really amazing when everybody comes together, and I would agree. Well, just another couple of quick reminders. Again, in 2 weeks, March 27th, Eggs and Issues will be, our state government officials, our local representatives will be here. And then, as I mentioned just a little bit ago, April 17th, Marionette Miller Meeks hopefully will be scheduled, and hopefully will still be able to join Eggs and Issues on April 17th. And who knows, maybe we could be back in Smoky Row for that one. I don't know. That would be great. But keep in mind that you are more than welcome to submit your questions to social media ahead of time or during the show. Okay, I guess we do have one more, and it's back to you, Jamie, and maybe it's a little clarification on that question. Maybe trying to clarify the question from another person. Catherine says, I think maybe the question was about the status of funding for 911 after the 28E was struck down to the supervisor's lawsuit. So hopefully that helps to put that one in context.
Yeah, so we've got a temporary contract in place currently, the 911 Board and the Emergency Management Commission. And then we are also using some federal funding that we received to cover the difference, so we're good till July. We will be having a meeting March 25th, location to be determined, to start working out a long-term contract, and hopefully we can get through all this and get back to work for the people.
Very good. I think that's going to just about do it. Again, I want to thank you guys for being here. Ken, my name's Joe Millage with KIIC. I am filling in today for Ken Alsop, who's on the road in, I believe it's Park City, Kansas, getting ready for an 11 o'clock tip-off today as the Statesmen are continuing to make their way through the tournament. And check back here at Oski News for additional information on how the Statesmen are coming along today in that game. We also want to just thank Smoky Row and Midwest One for providing our coffee today. And again, until next time, we are live here at Oski News KIIC Studios, and we will sign off for now. Thanks, you guys, for joining us, and have a great, great Saturday.